you okay? Are you sure you are okay? Are you experiencing discomfort or distress? Let us dive deep about mental health. Let us define what mental health is. Just like physical health, mental health is essential to overall well-being. It affects your thoughts, emotions, relationships, and ability to handle different situations.
According to Magpantay and Danao from the 1999 Surgeon General's report on mental health, defined mental health as successful performance of the mental function resulting in productive activities, fulfilling relationships with other people, and the ability to change and to cope with adversity.
Most mental health problems diagnosed in adulthood begin in adolescence. Half of the lifetime diagnosable mental health disorders start by age 14. This number increases to three-fourths by age 24. The most common disorders among adolescents include depression, anxiety disorders, and attention deficit, hyperactivity disorder, and substance use disorder. The exact causes of mental health problems are complex and often not fully understood. However, several factors can contribute to the development, including biological factors. This can include genetic predisposition, brain chemistry imbalances, and physical health conditions. Environmental factors. This can include stressful life events, trauma, abuse, and exposure to toxins. Psychological factors. This can include negative thoughts patterns, unhealthy coping mechanisms, and personality traits. Social factors. This can include social isolation, discrimination, and lack of support. It is important to note that mental health problems are not caused by a single factor, but rather by a combination of these factors. Additionally, different people may experience mental health problems for different reasons. Let us talk about depression. Depression is a common mental health disorder characterized by persistent feelings of sadness, emptiness, or hopelessness. It can also include physical symptoms like fatigue, changes in appetite, and sleep disturbances. To deep dive about depression, let us watch the video.
Major depressive disorder, or MDD, is a relatively common mood disorder that can impact the way a person feels, thinks, and behaves. For an adult to be diagnosed with MDD, they must have 5 or more symptoms of depression nearly every day for at least 2 weeks. These symptoms always include either depressed mood most of the day, nearly every day, or decreased interest or ability to experience pleasure. Other symptoms of major depressive disorder include unintentional changes in weight or appetite, sleeping more or less than usual, restlessness or sluggishness, low energy, feelings of worthlessness or guilt, trouble concentrating, and reoccurring thoughts of death or suicidal ideation.
Treatment for MDD should begin as early as possible to improve the chances of remission. Treatment usually consists of counseling, medication, or a combination of these.
Depression can also lead to changes in sleep, such as insomnia or excessive sleeping.
Depression can cause a decline in school performance, making it difficult to focus and concentrate. It can cause feelings of worthlessness, helplessness, or excessive guilt over minor issues. Depression can greatly impact your eating habits, causing either a loss of appetite or overeating. Eating disorder may be worsened if it was not prevented earlier.
Detecting feeding and eating disorders as early as possible is an important step in helping. Keep a few simple things in mind. Watch behavior. People with feeding or eating disorders often attempt to hide their conditions. Watch for behavior like withdrawing from family mealtime, refusing to eat certain foods, having a rigid rule about food, stockpiling or hiding food, calorie counting, excessive exercise, vomiting when not ill, or using laxatives. Try to connect. Talking about these challenges must be done empathetically, compassionately, and kindly. But the seriousness of the conversation must also be clear. People struggling with their thoughts about food and weight often feel alone, misunderstood, and hopeless. Unwavering support and personal connection from family is vital. Expect resistance. A person with a feeding or eating disorder can experience deep embarrassment, shame, guilt, fear, and hopelessness. It is important for family members to be as patient as possible. It often takes time and repeated efforts in order to successfully discuss concerns. Physical health can deteriorate. When feeding or eating disorders remain untreated and symptoms persist, family members may see dramatic changes in health, including sudden weight loss or weight gain, high or low blood sugar, easy or frequent bruising, unhealthy skin and hair, easily broken bones, gastrointestinal problems, rotting teeth, and other significant medical issues. Crisis is possible. Physical deterioration can lead to crisis. While most people receive care prior to a crisis, advanced feeding or eating disorders can result in life-threatening situations, including cardiac arrest, coma, organ failure, and suicidal thoughts and behavior. If this happens, emergency medical attention should be sought immediately. Treatment works. Feeding and eating disorders are serious conditions that are scary for the person suffering and the family. It's important for family members to confidently discuss the treatment options for these conditions and know that evidence-based treatments can be successful. Because these disorders are common, there are mental health providers, physicians, crisis lines, peer support groups, and organizations dedicated to providing useful, empathetic, and supportive resources for both patients and their families. People experience feeding or eating disorders together with their families. The conditions can be scary.
These are the voices of feeding and eating disorders. These affect millions of Americans and usually begin during adolescence. Self-image, food, eating, and body weight each become a source of serious anxiety for people, and they experience distorted thinking and behaviors that cause problems in their lives. These disorders can even be life-threatening. I know. One of these voices is mine. My own diagnosis was anorexia nervosa. I know now that it can be one of the most dangerous of all mental health disorders. I'm so glad that I got help. Anorexia is diagnosed when someone restricts food intake and loses weight until he or she is significantly below a healthy body weight. In my case, I got really underweight, although I didn't see it that way. My menstrual cycle stopped and I was exhausted. I didn't worry about those things because I also felt great. Feeling in control of something in my life made it easy to deny there was a problem. A lot of people with anorexia feel the same way, but if it's left untreated, anorexia can cause really serious medical conditions like bone and heart problems, and even lead to death. There are other feeding and eating disorders, including binge eating and bulimia nervosa. In binge eating disorder, people eat large amounts of food in a really short period of time. They feel out of control and helpless about their desire to eat, yet they can't stop. Binge eating disorder can also lead to a lot of medical problems like obesity, high blood pressure and cholesterol, and diabetes. People say they feel disgusted with and ashamed of themselves, which may be a result of the behavior, but also might promote the behavior. Bulimia nervosa also includes binge eating. Feeling upset with themselves, people then try to compensate with purging behaviors. Purging can be done through intentionally vomiting, using laxatives, or exercising excessively. People develop problems with their teeth from vomiting, including worn or decaying enamel and pain, and can also experience a sore throat, dehydration, or stomach problems. As with other disorders, people with bulimia also feel a great deal of shame and try to hide their binging and purging.
Did you know everyone, including kids like you, experiences different emotions? Emotions are feelings we have inside us. They can be happy, sad, angry, scared, excited, and many more. It's normal to feel different emotions at different times. It is important to express and acknowledge them.
Now let's talk about anxiety. Anxiety it is a common emotional state of worry, unease, or fear. It's a normal human response to stress, but when it becomes excessive or interferes with daily life, it can be considered a mental health condition. To know more about anxiety, let's watch this short video.
When you're studying for an important exam or when you're practicing repeatedly in front of a mirror before a presentation, it's perfectly normal to feel stressed out or anxious every now and then. Unfortunately, for some of us, our anxiety can get so out of hand that we feel this way constantly. That chronic feeling of anxiousness and fear is the marking of an anxiety disorder. Before we begin, we'd like to make a short disclaimer. Please don't use this video to self-diagnose. If you can relate to most of the signs, we do advise you to go to a qualified medical health professional for proper diagnosis. With that being said, Psych2Go presents to you the 7 types of anxiety disorders. 1. Generalized anxiety disorder, also known as GAD. It's the most common among anxiety disorders to be diagnosed. People with GAD suffer from intense and persistent worry. A GAD sufferer can worry or feel anxious about a number of events, ranging from school or work to their family life at home. This anxiety is associated with at least 3 of these symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, insomnia, or difficulty falling asleep. People with GAD often can't explain their anxiety using specific fears, like those with more specific anxiety disorders can. This is because their anxiety stems from various stimuli. Those who suffer from GAD can find relief in a number of treatment options, ranging from mindfulness meditation and brisk exercise to cognitive behavioral therapies and medications. 2. Separation anxiety disorder. This type of anxiety is more common in children than adults. For many, the mere thought of separation causes a high amount of stress. People with separation anxiety worry that something unexpected could separate them from their attachment figure, or that their attachment figure will abandon them. This anxiety presents as nightmares of being alone and a persistent refusal to leave their attachment figure. Kids with separation anxiety may be clingy and insist on sleeping with their parents at night. Children often grow out of separation anxiety disorder, but if it persists for 6 months or longer, they should be provided help. Adult sufferers may also find benefit from the available therapies. 3. Social anxiety disorder, social phobia, and selective mutism. Social anxiety disorder, also known as SAD, refers to the fear of public situations and exposure to unfamiliar people. SAD sufferers tend to avoid situations in which they're in the spotlight because they're worried that they'll be embarrassed or judged by others. The thought or the anticipation alone of an upcoming social situation can cause major anxiety-related symptoms like panic attacks or severe stomach pain. People with SAD may show signs of stress in these forms: little to no eye contact, freezing in place, running off, or avoiding tasks like eating in public. Children and adults alike can suffer from SAD, but some children with social anxiety may also have a more intense inability to function in social situations. Selective mutism is a type of social anxiety in which a child is unable to speak in social situations, despite being able to speak normally otherwise. Oftentimes, this problem arises at school or in the presence of strangers. If a child with selective mutism is able to communicate at all, they might only be able to nod or whisper. 4. Panic disorder. It becomes a disorder when an individual experiences panic attacks multiple times in their lifetime. Panic attacks are intense bursts of fear followed by a range of physical symptoms. These include at least 4 of the following: cold sweats, muscle stiffness or trembling, hyperventilation, which is fast, shallow breathing, lightheadedness, numbness, or the fear of death and/or insanity. The fear afterward of another panic attack sometimes actually provokes more panic attacks. More often than not, panic attacks are had in combination with other anxiety disorders. Therapy, along with medications, can help in handling panic disorder. 5. Agoraphobia. Does your local train station seem intimidating? Do you feel faint in a crowded place? Agoraphobia is the fear of public places. Anxiety arises because they deem them as too open or dangerous. It's triggered by fears like becoming a victim of crime or of contracting a disease or illness. Its sufferers coop themselves up in their homes where they're comfortable and familiar with their environment. Agoraphobes often become overdependent on other people to compensate for their inability to cope in public. Agoraphobia can develop at any age and can be extremely debilitating. Exposure therapy works effectively against agoraphobia in conjunction with medication. 6. Specific phobia. These are persistent and extreme fears about a specific object or situation and cause a ton of stress to the sufferer. Phobias can be environmental, like acrophobia, the fear of heights, and they can be animal-based or even situational, like taphophobia, the fear of being buried alive. Such phobias often arise due to traumatic experiences that cause people to make negative associations with these objects or situations. Someone who was clawed in the face by a cat in their childhood might have an avid fear of cats in their adulthood. In cases where exposure therapy may not be safe or applicable, cognitive behavioral therapy can be effective in changing a person's negative association to their feared object or situation. 7. Obsessive compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. Yes, OCD and PTSD were categorized by many psychiatrists as disorders to be grouped with the aforementioned anxiety disorders. Recently, there have been new findings about these disorders that deem them both unique enough to be in categories of their own. However, this is not to suggest that OCD and PTSD are any less important to deal with. The common thread that groups disorders like GAD, SAD, panic disorder, and phobias together is that sufferers of these anxiety disorders experience future-oriented fear. OCD differs in that though there is anxiety felt in the sufferer's obsession, they are able to find temporary relief in their ritualistic compulsions. Unfortunately, for OCD sufferers, this means a life of cyclical ritualism that can affect daily living. Those who suffer from PTSD may suffer anxiety-like symptoms similar to GAD or even panic disorder. But PTSD is unique in that it's past-oriented. The sufferer suffers flashbacks that bring them back to the event of their traumatization. If you're diagnosed with anxiety disorder, it's okay. Millions of people around the world understand what it's like to suffer from an anxiety disorder, so you're not alone. Understand that every single one of these anxiety types is often treatable and manageable. Also, if you know someone who may benefit from online counseling, we've partnered up with BetterHelp, an affordable online counseling platform that you can utilize. They're constantly striving to improve their services and terms and conditions. The link will be in the description box. Did you find this video helpful? If so, remember to share this video with those you think might benefit.